In Ohio right now, a 78-year-old woman is paying a bill she doesn't legally owe. Not once, every single month. And the letter that would have stopped it has been sitting in a drawer for 6 years because nobody ever told her what it said. This is happening to millions of seniors on Medicare right now, and the reason is almost too simple to believe. The program that erases these fees exists. It's fully legal, it's federally funded, and Medicare is not required to tell you about it. You have to ask. Most people never do. Today we're breaking down exactly which fees you can legally stop paying, which forms unlock it, why the deadline on one of them is closer than you think, and one mistake that disqualifies thousands of seniors who would otherwise easily qualify. Stick with me, because the fourth thing on this list saves the average senior more money than the first three combined, and almost nobody applies for it. Let's start with the fee everyone assumes is unavoidable, the Medicare Part B premium. It comes out of your Social Security check automatically, month after month, and most people just accept it the way they accept a utility bill. But there's a category of federal assistance called a Medicare Savings Program, and one tier of it called QMB, Qualified Medicare Beneficiary, doesn't just help with the premium, it eliminates it, along with your deductibles, along with your coinsurance. If you qualify, providers are legally barred from billing you for those costs at all. Not reduced, barred. And here's the part that should make you angry. Eligibility isn't as strict as people assume. Many states set the income limit higher than the federal floor, which means seniors who assume they make too much often don't check and walk away from thousands of dollars a year they were entitled to. But QMB isn't the only door. If your income sits just above that line, there are two more tiers, SLMB and QI, that won't erase everything, but will cover your Part B premium in full. That's real money back into a fixed income every single month, and the application takes about 15 minutes through your state Medicaid office. Most seniors have never heard the term Medicare Savings Program in their life. That's not an accident. Nobody's job is to advertise it to you. Here's where most people get tripped up. And it's the mistake that quietly disqualifies people who would otherwise pass with room to spare. States use two different counting methods for income and assets, and a lot of seniors self-reject because they're counting the wrong things. Retirement accounts you're not actively drawing from, for example, are excluded from asset calculations in most states. A car is excluded. Your primary home is excluded. So someone sitting on a paid-off house and an untouched 401k often assumes they're too well off for assistance, when in reality, none of that counts against them. The only numbers that matter are countable income and countable liquid assets, and those thresholds are higher and narrower in definition than almost anyone assumes going in. That single misunderstanding is probably costing more seniors their eligibility than actual over-income ever does. Now let's talk about the second fee, because this one hits harder for anyone managing multiple prescriptions. There's a program called Extra Help, sometimes labeled the low-income subsidy, that caps what you pay for Part 500 drug coverage. Under full Extra Help, your Part 500 premium and deductible can drop to zero, and your copays get capped at a few dollars per prescription, often somewhere between roughly $4 for generics and up to around $12 for brand-name drugs, depending on the year's federal limits. For someone managing 4 or 5 medications a month, that's the difference between choosing which pills to skip and actually taking what your doctor prescribed. And here's a twist most people don't know. You don't need to separately qualify for Medicaid to get Extra Help. It has its own income and asset test, and it's often more forgiving than people expect. There are seniors qualified for this program right now who have never applied, simply because they assumed Extra Help and Medicaid were the same program with the same strict cutoff. They're not. So that's two programs, two sets of monthly fees seniors are paying that they may not have to. Now here's the twist I mentioned, the fee nobody warns you about until it's already too late. If you miss the initial enrollment window for Part B when you first become eligible, and you don't have qualifying employer coverage, Medicare doesn't just make you wait, it attaches a penalty to your premium, permanently, for every 12-month period you went without coverage. That's not a one-time fine. That's a percentage added to your premium for the rest of your life. Most seniors don't find out this penalty exists until the bill already reflects it, and by then it cannot be reversed through an appeal, only through very narrow exceptions tied to provable employer coverage gaps. This is the fee version of a surprise you want to know about years before it applies to you, not after. Which brings us to the part that saves more than everything we've covered so far combined. And it doesn't come from Medicaid or a government office at all. It comes from inside the Medicare Advantage system itself. Some Medicare Advantage plans offer what's called a Part B giveback benefit. Here's how it works. Instead of you paying your Part B premium to Medicare and the insurer paying their own separate premium structure, certain plans will absorb part or even all of your Part B premium as an incentive to enroll with them. That money comes straight back to you, added into your Social Security deposit, not a discount on a future bill. Cash back into the check you already receive. Depending on the plan and your county, that giveback can run anywhere from a few dollars a month up to covering the entire standard premium, which at current levels is real money reappearing in your account every single month without you doing anything differently. And these plans aren't rare or hidden in fine print. They exist in most major markets, but they are never presented to you by default. You have to know to ask for a plan with a giveback provision, because the standard enrollment path just puts you into whatever the default option is. Here's another wrinkle worth knowing before you call anyone. Not every giveback plan is worth switching into. Some carry narrower provider networks or higher costs elsewhere in the plan that offset the premium savings. The giveback is real money, but it's not free money. You're trading network flexibility for it in some cases, and a good ship counselor will walk you through that trade-off instead of just chasing the biggest number on the page. Now stack all four things we've covered. Premium and cost-sharing relief from a Medicare savings program, drug cost relief from extra help, protection from a lifetime penalty you can avoid entirely if you act during the right window, and premium cash back from a giveback benefit advantage plan, weighed against what you'd be trading away for it. None of the first three require you to change doctors. None of them require giving up existing coverage you like. They require paperwork, correct information about what actually counts against you, and someone telling you these programs exist before the moment has already passed you by. And that timing question is not small. Enrollment windows for these programs run on federal calendars, and missing them means waiting up to a full year to apply again. Or in the case of the late enrollment penalty, being stuck with a cost that never goes away. If you're already on Medicare and you've never checked whether you qualify for a Medicare savings program, whether you meet the threshold for extra help, whether you're at risk of a penalty you don't know about, or whether your current Advantage plan even offers a giveback option, the fastest path is a 15-minute call to your state health insurance assistance program, completely free, completely unbiased, no products, no sales pitch, just someone whose entire job is walking you through exactly what you qualify for and what you'd be giving up in exchange. The woman in Ohio eventually found out about QMB from a caseworker at her pharmacy. Not from Medicare, not from her insurer. 6 years of payments she didn't legally owe. That's not an isolated story. That's the default outcome when a system depends on people asking the right question at the right time, and nobody ever hands them the question. You now have it. The only step left is making the call before this enrollment period closes. Title: Asterisk, asterisk, seniors, stop paying these 4 Medicare fees. You're legally exempt. Most don't know. Asterisk, asterisk, send the thumbnail whenever you're ready.